What's up guys, it's John with another Tuesday test tip. Today we're going to talk about flashcards. If you guys like these Tuesday test tips, be sure to subscribe because we're coming out with these every single Tuesday. Quick wins to help you get through nursing school. Today we're talking about should you flashcard or should you not flashcard. Here's the thing. Flashcards really play a role in the lowest level of Bloom's taxonomy. They're really playing a role in that memorize level. So flashcards can be helpful for things like pharmacology, labs, signs and symptoms, maybe even EKG if you have images or something like that. But flashcards aren't generally going to help you get to that analysis level of understanding. So if you're first learning something, if you're first learning a disease process, flashcards might be a really helpful tool. But I really want to encourage you to get beyond that and start diving deeper into understanding what's really going on with the patient, what's going on with the disease process, and how would you actually take care of this patient in a clinical setting. And that's what we've done for you inside NRSNG. If you do need flashcards, we actually do have them in there, but we really do encourage you to get to that deeper analysis level. Always be asking why. Always, always, always ask why. All right guys, for those who are studying pharmacology right now, we're gonna go ahead and put a link right down below in the description for our drug card template. You can download this, you can use it as many times as you need to. But let me encourage you guys again, I want you to get beyond the flashcard, beyond the memorized level of Bloom's taxonomy and really work yourself up to that analysis level. I want you to be asking why all the time. Don't just memorize signs and symptoms. Understand what's going on with your patient and what you would do to get them better. That's where we're thinking like a nurse. That's where your teachers are always saying critical thinking, thinking like a nurse. That's when we're getting to that level. All right guys, I want you to go out and be your best selves today. Happy nursing.